As they approach middle age, women may start to notice that it gets harder to maintain their weight. So what can women do to prevent weight gain in middle age? And are the new weight loss medications on the market safe? Hello and welcome to House Calls. I'm Dr. Eduardo Sanchez, Chief Medical Officer for Prevention at the American Heart Association. Weight gain can begin when women reach perimenopause, which is the name for the few years before menopause, and continue through menopause, which most women experience in their early 50s. This weight gain is caused by changes in your body's hormones. In menopause, the hormones estrogen and progesterone decrease, which triggers changes in your metabolism. One big change can be a decrease in muscle mass. And because muscle burns calories at a higher rate than fat, even when you're at rest, decreased muscle mass can lead to increased weight. And most women will see that increased weight around their abdomen. I've even heard it called menopause belly. And while increased weight around the abdomen might mean your jeans get a little tight, there's another reason for concern: your heart. Menopause belly increases your risk of diabetes, heart disease, high blood pressure, stroke, and respiratory problems. Here to help me answer these questions and more is Dr. Mauricio Gonzalez, a specialist in obesity medicine, as well as internal medicine and emergency medicine. His patients and his 1.6 million Instagram followers know him as Dr. Mao. Dr. Mao, welcome to House Calls.
Thank you, Dr. Sanchez. It's a pleasure to be here.
When women reach the middle years of their life, their bodies start to change. But despite the hormonal changes that come with menopause and the weight gain that can come with that, most women don't slow down. They're still living busy lives. Can you talk about some of the challenges women face as they approach middle age, how those challenges affect their health, and what they can do about it?
So what we know is that most of risk factors for cardiovascular disease, metabolic syndrome, type 2 diabetes, they do not start on their 40s or 50s. I mean, they start in the 20s, right? Sometimes earlier than that. But they get exacerbated by menopause and perimenopause because the fall of estrogen causes so many issues. The loss of bone density, the loss of muscle mass. There might be increases in the fat accumulation within the abdomen, and all of these together increases the risk for cardiometabolic diseases. Now, it's very important that we focus on prevention, but not in the 40s, 50s, but we have to start preparing women in their 30s for that stage of their lives so we can successfully treat it and have better outcomes.
Prevention is always a good approach, but what are the health risks if those issues are not addressed?
So most risk factors interconnect. Blood pressure exacerbates type 2 diabetes. Type 2 diabetes exacerbates blood pressure and atherosclerosis and so on. But we're very lucky because we know that most of the lifestyle changes that a patient requires to do are the same ones for all these risk factors. For instance, the Mediterranean diet, predominantly plant-based diet, exercise, no smoking, low alcohol intake, they all decrease the risk of chronic inflammation, cholesterol levels, blood pressure, and so on. So I think we need to focus on a healthy lifestyle.
Agreed. The science tells us that a healthy lifestyle, including exercise, a heart-healthy diet, sufficient sleep, and not smoking, are all important for maintaining a healthy weight and supporting our heart health. But what role do medications play in a healthy lifestyle?
So medications are a great add-on to lifestyle changes, and that's something that we fail to communicate. And that's one of the reasons why I love social media and medical education in the media, because you can debunk all these myths. And speaking about different communities, there's a lot of questions regarding these medications. And make no mistake, these medications save lives. But we need to reinforce them every single day, every time we can. It's not enough to see a doctor every 6 months and talk about these medications. That's not how the human mind works. We need repetition, we need education. These medications are a great add-on. We know from scientific studies that when we follow a portfolio diet or a Mediterranean diet, our LDL cholesterols can drop up to 20 milligrams per deciliter, which for some folks is more than enough but for some people, it's not enough. And then we need cholesterol lowering medications.
Excellent. Now, there's also been a lot of news recently about medications that can help people lose weight. This may seem like an odd question, but can you explain how these medications work?
No, I love this question because it's very important. Patients need to know how they work. So the conversation starts like this. I tell them that obesity is probably a brain disorder where their satiety signals do not reach the brain the way they're supposed to, so they don't feel full. So these medications, when you inject these medications into your body, these molecules go to your brain and basically tell your brain or force your brain to say, hey, I've had enough calories, I'm good. So this is great because it doesn't work in a very unnatural way. This is the natural way satiety signals work. We just help them with the use of these medications. And this reduces the food noise. So patients are not thinking about food all day long. So they can focus on making healthy meals, on breakfast, lunch and dinner.
Do these medications have any effect on how people digest the food that they do eat?
These medications, they also slow the gastric movement, how rapidly the food passes through the gastrointestinal tract. And in some people, it might be the reason why they have this nausea and vomiting and bloating, but it also helps to keep you full.
Can you tell us a little about some of the specific weight loss medications that are out there and what side effects people might experience if they take them?
Most of the weight loss medications that we have available are the GLP-1 receptor agonists, such as semaglutide. We also have another one that is a combination between GIP and a GLP-1 RA. And most of these medications cause adverse effects such as nausea, vomiting, sometimes bloating, and it's quite common. It happens in more than 77% of patients, but we're very lucky because most of these patients, these symptoms, they just go away after days or they're not severe enough. In a small proportion of patients, they might be severe enough to drop the treatment, but a lot of patients do very well.
And what can people do to deal with these side effects?
There's so many things that we can do to lessen the burden of these symptoms. First of all, eat smaller meals, high in protein, high in fiber, drink plenty of water, and exercise. So when you do that with these medications, you definitely lessen the onset of adverse effects.
Well, that's helpful. So how does someone know if these new weight loss medications are right for them?
Well, first of all, they need to speak to a doctor. But one thing that I really like about these medications when I speak to my patients in my obesity medicine practice is that these medications, society sometimes portrays them as cheating, as doing something instead of, which is 100% untrue. We know from studies that patients, when they take these medications, they're able to focus more actually on healthy lifestyle changes because the food noise goes down, so they're able to make better decisions regarding nutrition, exercise, and so on. So we have to emphasize that part.
I know that the FDA has approved several medications for weight loss. That's usually a good sign that these medications are safe, but are they a long-term solution? Because some social media makes it sound like these weight loss meds are a miracle drug.
Right, that's the $1 million question. We don't know how long-term. What we do know is that obesity is a chronic condition that probably will require treatment for a lifetime. How does that treatment look? It's impossible to tell, but it's very possible that some of these medications will be required for a lifetime.
One thing I've been wondering about is that if you look online, it seems like there's so many places that are willing to prescribe these medications right now. And we know that often people are looking for that miracle drug. They want that quick fix. And there may be some people out there who will be all too happy to sell these medications to them. So how can patients know if they're getting the right kind of oversight for this kind of treatment?
That concerns me a little bit. Why? Because obesity comes often surrounded by different risk factors. Blood pressure, osteoarthritis, high cholesterol, things of that nature that only a primary care physician or cardiologist or endocrinologist know how to recognize. So when people seek for these medications in places where they get just like one type of communication, just obesity and let's forget about the rest, I don't think it's appropriate, and I think it's detrimental to patients.
I agree. Everything in our body is interconnected, and it's important to understand how all of our systems work together. Now, one thing we haven't mentioned is that a lot of these weight loss medications are administered as a shot. If you have patients who want this treatment, but they're afraid of needles, how do you get them over that?
So we know that approximately 7 to 10% of the population, they're needle phobic, and it's an issue. And it's an issue not only for these medications, but also for things like vaccinations. So what I do when I practice is that I have one of these injections as a mock-up injection, and I show them how small and tiny and thin the needle is. And that sometimes eases their concerns. And I tell them we're gonna inject it here in the abdomen. It's a part that doesn't hurt a lot, but if you feel comfortable, why don't you come to my office and I'll give you the first injection. So you are in a very secure environment and we can deal with this together.
That's a great strategy. Dr. Mao, Dr. Mao, thank you so much for being here today on House Calls and sharing your insight with us.
This was incredibly fun. Thank you for the invitation.
Let's recap some key takeaways. Menopause and perimenopause cause hormonal changes that can lead to weight gain, increasing heart risk. The first way to prevent weight gain is through lifestyle changes, especially increased exercise and healthy eating. New weight loss medications can also help, but they're not a miracle drug. If you think weight loss medications might be right for you, talk to your doctor. And if you have questions about health conditions, I'd love to hear from you. Comment below, hit subscribe, join me here next time for Answers You Can Trust.